of the association. Thank you, Sarah. And we just wanted to tell you guys hi and give you any of our insight today. As M1s, we were just in your shoes a year ago. I know a lot has changed. But feel free to turn on your cameras if you'd like. If you don't want to, that's totally fine as well. But first things first is we're just going to go around and do some introductions from our executive team so you know who you're talking to. Emily, do you want to start?
Hey everyone, my name's Emily. I went to undergrad at Emory University in Atlanta, and I'm still figuring out what specialty I'm interested in. I'm the PR director for AWS.
And Lauren, you can go.
I'm Lauren. I grew up in Kansas City. I went to a small school in Arkansas, Hendrix, for undergrad. And I'm pretty set on something in surgery, but I'm still figuring out exactly what in surgery that will be.
My name is Sarah Adkins. I grew up in the Kansas City area on the Missouri side. I went to the University of Nebraska-Lincoln for my undergrad. Took some time off and came to medical school, and my heart is in surgery. Orthopedics is the goal right now, but much like Lauren, something sweeps me off my feet, I'm ready for it.
And my name's Quinlan. I also grew up in the Kansas City area, but on the Kansas side. I did my undergrad at Pittsburgh State University, and then I dabbled a little bit in pharmacy school at KU for a couple years before coming here. Right now, I'm really interested in transgender medicine. So I don't know what that kind of looks like for me. There's a lot of different avenues that you can go, but I'm excited to figure it out. So first things first, we will put all of our contact information in the chat for you guys. If you hear anything that we're involved in and want to ask us more questions personally. But also too, if you guys want to ask any direct questions, you can feel free to unmute your mic and just ask it aloud. Or if you don't want to do that, you can private message me on the Zoom call and I can ask the questions for you. So we thought at first, if you guys had any burning questions right now, then we could answer them now. If there are no questions, which I think that might be the case, then we can just start going into some of our topics that we have for you guys today.
Hi, I'm Samira. I just started, it's my second day in med school. I was just curious to women or how many people are part of this organization.
Sorry, you cut up for part of it. You asked how many people are in the organization?
Yes.
So right now, our roster on the beat, which just totally separate aside, any group you want to be involved with on campus uses the beat sort of like a central hub for managing their rosters. So on the beat, we have about 80 right now, and that doesn't include anyone from your class. So no one from your class has been added. And then we also have like a bomb list of like another probably 40 women who are surgeons here at KU who serve as mentors for us. So they are part of it. Many of them were AWS people at their respective medical school or here, or have become involved since becoming residents, because we all know mentorship is so important. So it's a little bit bigger than it might seem. Obviously not everybody does everything, but it's a pretty solid group of humans.
Cool, thank you.
And I just got a private message, and this was actually the first topic we were going to talk about anyways. This is great, throwing us into that. They want to know what outside study resources we use for medical school. So does anyone want to take this first?
I can go. So I mostly, for the basic content knowledge, I use a lot of their lectures because they're really great at getting down to exactly what they need to know. But if I have specific questions about something, or I want to learn about a topic in more in depth, I'll go to Boards and Beyond. That's become my favorite for topic specific information. In an IBI, Sketchy saved my life with all the different bugs and drugs. So those are the ones that I use the most. Other people like Osmosis, and some use First Aid, but I haven't exactly figured out how to use that to the best of my ability.
Similar to Lauren, I would back up. So I like to front load my content with that. So for our lectures today, for example, last night I was watching sketchies over the topics. Sometimes sketches of everything. So like Lauren, I go to Boards of Beyond or Passoma. Sometimes First Aid because their mnemonics are awesome. And what is it? Is it Med Ed Media is like an awesome set of free videos that I found. Like the guy is phenomenal. He's an excellent teacher. He like whiteboards the lectures out. So to be fair and transparent, very rarely do I ever use all of those things for the same content. It really is like a pick and choose, because some will present like Sketchy is great for bugs and drugs, like Lauren said. It's not honestly that awesome for biochem. So you kind of pick and choose based, but that's generally my lineup of things that I go to if I don't understand something or if I need help.
Yeah, my favorite resource is definitely Sketchy. It's gonna be amazing when you're in IBI and you're learning all the drugs and all the bugs at the same time. I know a lot of people that use Anki. I personally tried it and it didn't really work that great for me. It was hard for me to stick with it. So I don't really use that anymore. A lot of these resources are going to be based on sort of your personal preference. I like First Aid a lot. The way that I use First Aid is usually when I'm reviewing a topic for an exam. That's when I kind of look through the First Aid stuff, because it's a good job of summarizing the information, but you can't learn the information from First Aid. And then I recently got Amboss over the summer just to get ready for step prep, but I think Amboss is really awesome. I don't think you really need it as an M1, but I think it would be a resource to think about when you're getting ready for boards.
And I'll just say that I'm probably the worst person to ask this question to, because I honestly did a terrible job of using outside resources in 1 year. But I will be the first to say that you can definitely do well your M1 year without using outside resources. If you don't have the financial means to get those resources, some are expensive. You didn't hear it here, but there may be some way to get it without without paying the money. Maybe ask some upper classmates. But just kind of the names that those people that everyone was saying. Sketchy is a video, a little video that you watch, and it's created by a doctor that draws these pictures and just gives you like ways to memorize a lot of information for blood infection and immunity block, but also it has a lot of other things. Anki is just the flashcard deck that you probably see people using a lot. There's a long YouTube video that explains how to set it up if you want to be like an Anki king or queen. And Amboss is just like another platform to review material. And when people say First Aid, they are talking about a big book that people carry around, and they come out with a new edition every year. Because I know whenever I was in med school and people started talking about Sketchy, I'm like, Sketchy, this is sketchy. I don't know I don't know what Sketchy is. So if we'll put those, how you spell them, in the chat so you guys can look them up too. But does anyone have, oh, go ahead.
Sorry, a quick aside, Quinlan brought it up earlier, and I think it really is important. You can get resource poor really fast. All of these, if you didn't happen to find a free copy floating around KUMed, they're very expensive to buy them all, and there are so many more. So I think truly, hopefully we demonstrated that in a small sample here, but like figure out what works for you before you lay out money for resources, and then the time it takes to use them. Unlike Emily, I bought Amboss last year. I used it not that much. It was expensive, so I'm really need to use a lot more this year. So don't make yourself resource poor or time poor trying to like make all those resources work for you. Find what works for you first, and then invest your time and money accordingly.
Yeah, like Emily said, the free trials, I spent a little time during ITD, because you're not quite as busy in it, looking at the free trials of all the different things and trying to figure out what I thought my personality might allow me to use the best. So I did spend a little extra time in ITD trying to figure out what I thought would work.
And kind of sort of piggybacking off of that, also, if you guys have any questions about any of the specific resources we talked about, you can send in the chat or private message any of us too, or ask aloud. But I just got a question that you guys had your first surface anatomy lecture today, and it was a lot of information and pretty overwhelming. How do you suggest how to digest that information, and are we responsible for knowing this down the road for other blocks? So we are, if you didn't know, the M2s are starting our musculoskeletal block right now. And so we're going to have a lot of anatomy too. You guys are in a way better position than us to have COVID kind of dying down, knock on wood, that you'll be able to get into the anatomy lab more. I assume that you had your lecture from Dr. Keim. She is a great lecturer. She gives you a lot of information. What I would recommend is whenever you do her flipped classrooms, that you really focus on what the questions that she asks you to know. She's not going to ask you like off the wall, like anatomy questions. They're going to be like application questions that you can kind of work through. And the best way that I would say to practice those questions are using your formatives. So, and that brings us to talking about formatives. And I know at this time last year when people were talking about how they took their formatives, I didn't even know what a formative was. So how about we just tell them what the formatives are for and how we take them?
So the formatives are like essentially practice questions that you give, since every lecturer writes their own questions and they all have a little bit different of a style, and it's not exactly the same as what we'll see on step one. It kind of gives you an idea of how they write, how hard their questions are going to be, how nitpicky about details they're going to be. It's not always entirely accurate to what you're going to end up seeing on the test, but it can give you a good prediction of the type of stuff that they think is important. And they'll be like, you'll get like at the end of the week, or I guess they release it on day one of the week, but they'll have questions from each lecture you had, between like 5 and 10 questions for each lecture. And you can do it whenever, and it's not a grade.
I saw a question in the chat about best place for practice questions. That is it. The people who are going to write your test questions also wrote the formative questions. My understanding of it, to be quite honest, is as a lecturer, maybe I submit 15 or 20 questions, they throw them in, the block director will pick some for the test, and the rest will become formative questions. So don't sleep on your formatives or your post-CBCLs or your pre-CBCLs, your IRAD, or like anytime any lecturer gives you free questions, do their questions. You've already paid for those, your tuition's paying for those. And I would manage those first, and then if you really feel like you need more questions, Emily mentioned AMBOSS. AMBOSS is tons and tons and tons of like very esoteric practice questions. You get USMLE RX your second year, but I had some friends who bought it last year and loved it for practice questions. Again, I think it comes back to use the free resource first, see if you like it, see if you need more before you, because again, you don't, I mean, unless you just have like tons of money you don't know what to do with, you don't want to make yourself resource poor and spend a bunch of money on stuff you can't like actually use for what it's worth. So that would be where I would start for practice questions.
And I would just add that it's a lot more important to actually go through the questions that you're getting wrong and some of the ones that you get right, to see if you're thinking about them correctly and if you actually know how you got to the answer, than it is to just do like hundreds of practice questions. So keep that in mind when you're looking at different resources, and don't try to just buy a bunch of questions so you can do a lot of practice, because the review is what's important.
And going back to the formatives, you will find those on Blackboard. I personally, starting out in 1 year, I did not know how to study, and I think I would take the formatives like the Wednesday before the test, which if that works for you, that's great. But I kind of pushed that back to, I would take the first week formative on the weekend sometime. then prepare for the second week test, and then take that formative, hopefully on Tuesday night for the second week, because that's when you're done with new material. But I would echo that the formatives are the best way to practice questions and see if you're actually digesting the material. Some people like to take it a lot differently. Some people like to take it like a real test, so you're not using any of your notes, not looking at any of the answers. The way that I do it, because that stresses me out too much, is that I actually pull up 2 different tests. I submit one of the tests, so I see all the answers, and then I go question by question. And so I answer one question and then I go look at the answer and see if I got it wrong or got it right, because then if I got it right, it reinforces it. If I got it wrong, I figure out where I got it wrong. But everyone does it differently. So I would say just try out some different methods and find out what works for you, but use them definitely. And I just got a question, is there a formative exam for each week? Yes, correct. So there's a formative exam for each week. They will have various amounts of questions on them, but very similar to like what kind of, how many questions there would be on your actual exam. And like Sarah said, they are questions that have been written for a test, but just have been, some have been shuffled over the formative and some have been shuffled over to the test. So definitely take those.
Yeah, oops.
Oh, go ahead, Lauren.
I was just gonna say, don't be alarmed if if you're taking it like an actual test to study, because that's how I do, is I like review everything, take it and see how I do. Don't be alarmed if the score you get is below what is considered passing. You're probably taking it early enough that you're going to do more study and you're going to learn from those mistakes. So like the first couple that I took were severely below passing. And that totally freaked me out, but it's fine. You have time to get it like figured out. And by taking it, you're actually helping yourself.
They say if you get a 50% the first time you take the formative, and you take it early enough, then you'll be fine for the test. So, does anyone else have any questions about outside resources or kind of how school's set up here or anything like that? Okay, if there are any, we have some time at the end that we can also answer those questions. But a big thing that we want to talk to you guys about is just getting involved. Obviously, we know that you're all here for a reason, and I'm sure that you were extremely involved in your undergrad and doing amazing things, and just emphasizing that you are able to continue to do that here, and we want you to continue to do that here. And you'll be able to do that also managing school or home life and things like that. So there's a lot of different ways that you can get involved. Obviously, you guys have seen a ton of emails lately this first week from a bunch of clubs trying to get you guys to join, I guess, just like us. But you definitely do not have to join this club. We just wanted to give you guys some insight. But I know that there's a lot of questions about JDoc. If you guys don't know what JDoc is, it is a free clinic run by us medical students here. We have volunteer physicians that take care of the legal things so that we can actually see patients. But it's a great service and volunteer opportunity. And so we just kind of wanted to explain that a little bit to you. So you guys will obviously get more information from the JDoc executive board about this, but you have to go through training first before you can volunteer. So I guess I'll let Emily start talking first, because Emily actually is one of the specialty night directors for a night at JDoc.
Yeah, so JDoc is a really great opportunity to get involved and sort of practice your clinical skills in a really low risk setting, because you're working with attendings and like it's not an emergency setting. You're not going to be able to like mess up or hurt the patients in any way. It's a great way to learn. It's a great way to meet new people. And because of our school schedules, it's kind of hard for us to volunteer at other places during the day. JDoc is in the evening. Typically shifts are from 5 to 9 p.m. So that's really perfect for student schedules because you have class during the day and then you go volunteer in the evening. I'm a specialty night director for dermatology night. So there's quite a few specialty nights. There's a really awesome transgender night, which Quinlan helps run, and I'm sure he'll talk about that more later. But there's also ophthalmology, MSK, diabetes, and women's health night. And then there's also radiology night, but that doesn't take volunteers. So those are your options. And then there's also general night, which is going to actually shift to walk-ins. So when you volunteer there, you will get to see a huge range of patients.
And also for you guys, when you do volunteer at JDoc, it can be scary at first, but when you guys volunteer as M1s, you will be taken under the wing by hopefully an amazing M2 and kind of show you the ropes. So they will just be having you take some vitals and stuff, which you will be taught how to do blood pressure and stuff like that, I think probably this week in your clinical skills lab. But basically you're just learning from the M2 or M3 or M4. Sometimes they like to volunteer too, if they're not too busy with rotations. But once you guys have been trained, and they probably maybe have already sent out that email, I'm not sure, but that will happen soon. And then you guys will be able to volunteer in the next upcoming months. They send out a schedule. Right now it's every the 15th of every month. And so I would just be on the lookout for that email because spots go pretty quickly. But yeah, that's something that you should definitely try out first, even if you're a little bit uncomfortable with it, because I think a lot of people are surprised by how much they love JDoc. And so there's opportunities later on to get involved with the JDoc board. That's obviously way far down the line. Don't be worrying about that too much. But if you're really interested in those kind of service events, definitely something to be looking out for. We also have another free clinic that we run here, and it's called Bulldog. So those are two separate things, but both run by KU medical students. And so Bulldog is just tailored to a different patient population. I believe that they work with the Wyandotte County High School. And so they're doing various things with that patient population. So adolescents. So they will also have some signups and a different training that you will have to go to do that. So if you're interested in peds or adolescents, or just want to get some, great community service worked in with them, that's a good opportunity too. But those are just separate clinics, just to clarify. Does anyone have any questions about anything we have said so far? Or any more questions about JDoc? Okay.
I have a question actually.
Of course.
So for example, if you go to a specialty night, like for example, like dermatology, what kind of procedures would you get to participate in, or what kind of exams?
Yeah, so I think dermatology night's really fun because you get to do skin exams. We don't actually do a lot of procedures at JDoc because some of those materials can be really expensive, and we are a free clinic run by students. So if we have to do like biopsies and things like that, we'll actually refer them to a different free clinic that's run by the derm residents. It's called Casey Care. If that's something you're interested in, I'm also involved in our dermatology SIG on campus, and we actually have signups for volunteering. You would need to sign up with us on the beat in order to get access to the volunteering signups for that. But they do procedures over there. At Derm Night, we mainly just see patients and then write scripts for them. At other specialty nights, like at MSK night, you can do like those exams. And then like diabetes night, primarily they focus a lot on doing labs for their patients. For optho, the residents do the eye exams. There's a special room in JDoc where they have all the equipment for that, but you can like take the patient's eye pressure. They have a little gun that you can like literally put on their eyeball to take their eye pressure. And then mostly at JDoc, the procedures that you're going to get to do would be giving shots. So flu shots, other types of vaccinations. We do give steroid injections at Derm Night sometimes, so you could do that, but I'm not really sure of any like other procedures that you would be able to do at JDoc.
For women,
And is the, oh, sorry, go ahead.
go ahead, Samira.
Yeah, I was just curious if the KC Care thing organization sign up, is that competitive as well, similar to JDoc?
So there's a lot more opportunities at JDoc than there is at KC Care. We typically are only able to offer 5 shifts per month. So it is a lot harder to get in there. But like, I would definitely at least try to go to JDoc just because it's still going to be a great opportunity, even if you're not getting to do procedures.
Thank you.
For Women's Health Night too, they do pap smears and IUD placements, steroid injections for MSK night, some other things, just some other physical exam things that doctors may show you that you haven't learned yet. But yeah, it's just a great opportunity to get involved and help out the underserved community of Kansas City. And we also have people that travel from far away that aren't even in Kansas City. So. I'm just looking to see if we have any more questions right now. Okay. There's bottom line, there's a ton of ways to get involved. Obviously there's a bunch of student interest groups. Some are more active than others. Some have a lot more in-person events than others. We're all trying to transition right now to figure out, what's happening with COVID. But it's a great way to meet new people and figure out, the things that you're actually interested in. And it's also a great way to maybe get some free food or maybe some gift card raffles and things like that. So we definitely recommend trying to go to as many things that interest you as possible on these next couple weeks, especially before you go into your next block, because intro to doctoring is pretty light compared to your next block. So I would just try to take in all the information that you can and figure out if there's, a club that you really want to be involved in and or things like that. But you will be able to, I promise, balance school and your extracurricular activities.
I'm gonna follow up with what Clement was saying. Most clubs and organizations aren't going to select for leadership roles until December, like November, December. So the more you can get if you think there's something that like trips your trigger there, if there's something you want to be involved with, now is a wonderful time. Just like no commitment, no obligation. Go to one of their meetings, go to a social event or a speaker panel, whatever they have. See if it's something that you want to give your time to. Because I think, speaking for myself, I was a serial joiner in college as a part of everything. I like being involved with everything, but like Quinlan used the word balance. You can't actually be in everything and do school really, really well and research and all this stuff. So you will, to a great extent, need to prioritize like what really gets your time. So this semester is a really fantastic way and like moment kind of in your medical school career to figure out what is going to be worth your time later, because you're going to want to join some leadership things and have that on your resume when you apply to residency in 4 years. Not to put a lot of pressure on it, but like try things out, see what you like, so that you can start that critical process of deciding what truly will actually be worth your time and something that you are willing to give your time to.
And especially too, now that we are going to have step 1, which is our very first boards test that you take after your second year of medical school, be pass fail, starting with our class, and you guys will be the second class. We're all trying to figure out kind of ways that we can stand out and set ourselves apart from one another when applying for residencies. I know that seems like it's like really far away, which it is. Don't freak out about it, but it's just something to always keep in the back of your mind. Getting involved in extracurriculars and just getting involved in like our amazing student life is great, not just in the medical school either. There's a lot of different clubs that incorporate a lot of the other health professions, professional schools as well. And that's super fun to get involved in, meet those people too. And so I just got a question actually that was going to jump right into our next discussion, which is great. Have you guys found mentor or mentors? If they're doctors at the hospital, how did you guys initially meet them or become introduced? And how does, that process kind of start? So Sarah, I'm going to let you take the lead on this one. I know that this was something that you really wanted to hit home. So
It is. So to address the broad topic of mentorship, I would say almost all, if not all, of the medical specialties that you will want to go into, successful people in them will say, when you say, how did you find your way to urology, nephrology, transplant surgery, ER medicine, like whatever it is, they'll say, I had a great mentor. And that mentor was somebody that opened doors for them. And also, PS, big difference between mentorship and sponsorship. You also need to find a good sponsor. But you start with a mentor, somebody who you can ask honest questions to. You might not be thinking about it now, but like what kind of life do you want to live? Like, do you want to be somebody who's literally on call 24/7, but you get to like cruise in the jet and transplant hearts and livers and lungs, and that's your thing? That's a very different lifestyle from a family doc. So finding mentors, they will give you honest feedback on what their life is like, because this is a career, but this is theoretically the rest of your life. And so you want to make sure that you're happy with many of the aspects of it. So I think finding a good mentor, no matter what your field you want to go into, is everything. That mentor is then going to help guide you and get you in the right rooms with the right people on the right research projects. They'll also hopefully be honest with you and tell you which ones to avoid, because again, you don't have time for everything anymore. My mentor is a goddess and I love her and I would do anything for her because she's amazing. She has put me in the right rooms with the right people, and I feel like significantly adjusted the path that I'm on to get to the surgical specialty that I want. If I didn't have her, I would not feel as prepared or competitive as I do at this moment. And there's still a lot of road to travel, but like, she hooked it up and I love her for it. I found her by Googling what professors existed in that specialty, reading their bios, kind of checking them out, seeing what they're interested in. You can go to the NIH database, plug in someone's name, see what they publish. The kinds of research that she published were interesting to me. She holds tons of leadership roles, like in the world at large. I would go to like different, just like this. I'd sit in on different Zoom meetings from different like national groups, and Mother of Pearl, that woman was there speaking to people. She's awesome. And so I literally sent her an email one day. I was just like, hey, I tell people it was like a weird bad date thing. I was like, hey, I'm an M1, I don't really bring anything to the table. I'm not that smart. I haven't published anything. Like, I don't have any NIH money. But would you spend your time and resources on me and help me grow? Because I think I want to do what you do. And some people you have to email 10 times. I got an email back from her in 5 minutes. It's been phenomenal since then. Not everybody responds like that. You might have to knock on a couple doors. Some people, if they're good and honest, will tell you if they don't have time, but hopefully would refer you to, hey, I've got a colleague who I think would be really great. The bottom line is you have to ask. You have to say, hey, you have to respect their time because they're all really busy and they're all really good at what they do. Say, hey, this is who I am. This is what I want from you in a very nice and kind way. This is what I would like to get from our relationship. Do you have time? Would you be interested in talking about this? And see where that email gets you.
I would definitely echo what Sarah's saying, and the fact that you kind of really had to put yourself out there. And putting yourself out there, meaning like cold emailing people like Sarah just said. And that sounds really weird. And I promise you, the same thing happened last year when I was in this meeting listening to the M3s now talk about this. And they were like, yeah, I knew I wanted to do research in diabetes. And it was Christina. I knew I wanted to do research with diabetes. And so I went on KU's website and looked at the physicians that are doing diabetes research. And then I cold emailed them. And she, found a great mentor in that. And I think, I know Sarah was saying, talking about publishing papers and things like that. Even if you're not a big research person, I feel like that's a great way to find mentors. So if you're even not a research person, just get on one research project. It's a great way to stay connected with that mentor or primary investigator of the project because you have to keep the project moving. So you get to talk to them a lot. I think a lot of things is like you find good mentors sometimes, but you don't know how to continue that relationship. And I think that research is a good way to continue that relationship because you're continually working on a project that you guys are both benefiting from. And that's how the best relationships form. I would encourage you guys to, I know that you guys will be getting a lot of emails in the next couple of weeks too, asking if trying to get some M1s to do some of the research, do some of the work on the research. And I would say just take a leap of faith in that, and any research opportunity that kind of comes your way that you might sort of be interested in to take and run. That's the only reason right now that I am interested in trans care because the 2 weeks into school, I emailed someone and asked if I could be on their project transporting reproductive tissues from transgender patients in the OR. And now I'm one of the specialty night directors for transgender night at JDOC and on multiple research projects for transgender care. So it just, you don't know like how far that can take you. But I just think like the biggest thing is you guys just got to take a leap of faith and do it. I promise no one's going to judge you for sending a cold email. Like Sarah said, they might not reply, but they are busy and you might just need to follow up.
I think the flip side of Quinlan's coin to just like take a leap of faith is be calculated. Don't overcommit. These are super, I don't want to say they're like important people. It makes it sound like children, but like these are very educated people who are very good at what they do. And to put a very fine point on it, their time is literally worth hundreds of dollars an hour. Okay. These people have grants. They are salaried professionals. Like their time is really valuable. So don't waste it. Do not reach out to them. Do not try to engage in mentorship if you yourself are also not serious about it. It's very okay to wait a couple of months and just sort of see it. Like Quinlan said, you will get emails and 97 people are going to respond like right away, that's cool for them. It's also okay to take your time and choose wisely, because if you choose wisely, ideally the fruits of your labors will be great. If you choose poorly and you are not a good mentee and you don't pull your weight and you waste their time, all the physicians talk, and that honestly I think would be worse to have a bad reputation than to have no reputation at all. So choose wisely and be serious when you commit.
And I will just add on mentors. It's not just physicians and faculty that are going to be your mentors. You're also going to have mentors that are M2s, M3s, M4s, and also residents. And so you can also reach out to those people as well. I think especially reaching out to upperclassmen, it's a lot more low risk because, you know, if you just want to ask somebody a question and you don't know, like just email an M2 that you know, and they can still be your mentor and you can still get advice from them.
Lauren, do you have anything?
I just reiterate what Emily said, because the research project that I'm doing this summer, I was talking to an M2 about the person that I ended up working for, and she gave me a very honest like evaluation of what it was going to be. She's like, it'll be a lot of work, probably more than what some of your classmates will do for their research. But in the end, like if you put in the time for them, you'll get something out of it. So they can be a great resource for also helping when you're trying to decide with research projects or anything else, because they may know the people or have worked with them in the past.
Does anyone else have any questions about finding mentors or anything like that? I've got a question. What are time efficient opportunities to explore mentorship, shadowing, and or research opportunities in different fields if you're not sure what you want to get into? The first thing I'll bring up, and I'm sure that they've told you about, is our SIR weeks. So it stands for Scholarship Enrichment and Remediation, I believe. So these weeks are at the end of each block. And if you have not failed the same test twice, which you guys won't do, I promise, then you get to have a SIR week. If you do, then you have to remediate on the CER week. But the CER weeks are designed just for that, to shadow a specialty that you might not be sure about. Maybe you're super interested in. Maybe you just want to see how it is, but you will get the chance to kind of put in your rankings for what sort of CER week you want to do. So there have been CER weeks that you could ride in the ambulance for a day and see what emergency medicine is like. There's CER weeks that you can follow around someone who's just in clinic all day. You can go to the OR, just everything, honestly, any kind of specialties that you want to have, you can. You can also do some CER weeks that are just learning about more about racism in medicine, about bias, things like that, about personal development. So those CER weeks that you will have at the end of each block, I would say just take advantage of them, as most advantage of them as you can, because those are the opportunities that in the time set aside by, our administrators to allow us to explore those kinds of things.
To expand on that too, the question about being time efficient, I would honestly say go to meetings, go to panels. Every student group has an advisor, and that advisor is plugged in that field. AWS, we're going to have speed mentoring night. We're going to put you in a room with tons of surgeons, several different surgeons at different points in time, a small group, and that's when you ask them, you say, hey, tell me about this. What do you think? There are some mentors who have, reaffirmed for me fields that I have no interest in, and others that have piqued my interest and, made it move that up on the list of things I want to actually invest my time in. Because again, you want to be time efficient. So go to those things, listen to those people. Student surgery, we're gonna have like a big session on research. That's 1 hour of your life where theoretically someone else, AKA us, has done all the work to expose you to as much as we can, as fast as we can. So I would say clubs are really, really great for that. It's not like clubs in high school where you just make t-shirts and posters and whatever. But if you leverage those correctly and you listen to the faculty that's involved in sponsoring those, I think you have a really great insight and window into whatever specialty is sponsoring that group. And you can get a lot of information quickly and honestly.
Is there any other questions that you guys have? Any specific questions? If not, we have put our contact information down there. If you guys want to contact us about anything that we've talked about, or really anything, AWS or JDoc or whatever. A lot of us are in various clubs too, not just AWS. We've talked about some, and we all kind of want to do different things in the field of medicine. So we would love to talk to you guys. We're excited that you're here. And we, as the AWS exec team, just shameless plug, if you want to follow us on Instagram, we have a lot of different events coming up. You do not have to be a woman or identify as a woman to join AWS or go to any of our meetings at all. And we would love for any of our male or non-binary classmates to join us too. So we look forward to seeing you guys, and we can put our Instagram out if you guys would like to follow us on there to see more. But thank you guys. I hope you have a good rest of ITD. Soak it up while you can, and then hit the ground running for your second block. Thank you guys.
Thank you. Have a good one.